diaper rash really is? It's actually quite common in the area covered by a kid's diaper and shows up as red, inflamed skin, and this usually happens when babies are exposed to moisture for too long. Think the pee and poop irritating their super sensitive skin. One specific type of diaper rash is called diaper dermatitis, which can be triggered by tight-fitting diapers, changes in what the baby eats, or even certain baby wipes. So yeah, it's a bit of a combo of factors. A diaper rash on a baby boy looks different than a little girl diaper rash, so the appropriate treatment and care needs to be tailored to the child's specific needs. Don't know if your baby has diaper rash? The baby skin condition typically appears as bright red patches on a baby's skin, particularly in areas that come in contact with the diaper. Common signs include soreness, tenderness, and peeling skin, and in more severe cases, it results in blisters, open sores, or pus-filled lesions. If your baby has any of that in their diaper area, it's a diaper rash. Parents should also look for signs of discomfort like fussiness while changing the diapers, or areas of redness that get bigger. Did you know that between 7% and 35% of infants get diaper rash? There are plenty of other rashes that can pop up, but diaper rash usually shows up as a red and inflamed skin on the butt, lower belly, genitals, and upper thighs. It also doesn't usually appear in the little skin folds in the diaper area. Other rashes like eczema make appearance on face, legs, arms, and come with the side effects of itchiness. Then there's seborrheic dermatitis, which brings yellow, greasy scales into the diaper area and other creases. Impetigo, on the other hand, is all about those yellow, crusted lesions. The easiest way to tell a diaper rash apart from other rashes is by checking where it shows up. If it's covered by a diaper, that's a giveaway. And remember, it won't usually appear in the folds of the skin unless there's a secondary infection going on. Diaper rashes need to be handled immediately so they don't spread. I'm going to give you the full breakdown of the symptoms of diaper rashes to help you stay on top of it. Redness is usually the first sign of diaper rash. Swelling is a result of irritation and inflammation. Blisters can show up in more severe cases and rupture and end up being pretty painful sores. It means a high level of inflammation and means you should be headed to the doctor. When the rash starts to get better, the skin dries out and peels. This usually happens if they had the rash for a long time, but this just means it's getting better. If you touch the skin and it feels warm, that can indicate an infection or a more severe diaper rash. Your baby will show signs of discomfort, such as fussiness or crying when changing diapers. Small pimples can appear in the diaper area, indicating folliculitis or inflammation of the hair follicle. Friction from diaper causes chafed or bumpy skin. These regions feel itchy and sensitive to the touch. Secondary infections like a yeast infection or a bacteria infection will make a diaper rash worse and cause more redness, swelling, and discharge. Did you know that baby diaper rashes can spread? It can move from the butt to other parts of your baby's body, mainly if a yeast or bacterial infection causes it. Shiny, bright red patches with sharp edges are a good sign there is a yeast infection. Also, little pink bumps or pimples. It's usually worse in the skin folds. Bacteria infections look like bright red skin surrounded the booty hole or yellow crusting and weeping. I'm sorry, I wrote that based off my blog post, which cites scientific studies, and that was horrendous to say. But anyway, these infections require medical attention to prevent spreading. Ever wonder how long diaper rashes last or when to call a doctor? Generally, they stick around for a few days to a couple weeks, depending on how bad the rash is and how well the treatment is working. Mild rashes usually show improvement in just a few days with the right care, but if the rash is more severe, it might take a little bit longer to heal. If it seems to drag on, it could mean that there's a fungal infection or a more serious issue at play. Definitely see a doctor if you notice a fever along with the rash, if it's severe or unusual, or if it gets worse despite your efforts. Also, look out for signs like bleeding, itching, oozing, or any burning during diaper changes. Better safe than sorry. Did you know that baby rashes are painful for babies? Babies often cry or get fussy when touched or cleaned in sensitive areas when they have a diaper rash. The pain worsens if the rash turns into a yeast or bacteria infection, which causes blisters or oozing sores, which are more serious types of this condition. Treat diaper rashes immediately to avoid further issues. These rashes are common with babies, especially infants, wearing plastic diapers. The material traps moisture against the skin, creating a warm and humid environment that causes this irritation. Friction from tight-fitting plastic diapers lead to chafing. I love bamboo diapers with zero plastic in them. The best thing to do is change diapers a ton to get proper airflow and also let their jibs breathe for a few minutes. I used to have a theme song with my kids when I would do this. It's called Air airing out the hooch. I felt such guilt when my kids had diaper rashes, so I'm sharing the leading diaper rash causes that help you prevent them. Diaper rash is most often the result of prolonged contact with dirty diapers. Regularly check the baby's diaper and change them often. Tight-fitting diapers or clothing causes chafing, which makes the irritation worse. Continuous friction, especially with moisture, breaks down the skin's protective barrier, increasing the risk of developing a rash. Sensitivity to diaper materials, wipes, or creams triggers a rash. Bacterial and yeast infections develop in the warm, moist diaper area and worsen existing rashes. Introducing solid foods changes your baby's poop, increasing the risk of rashes. Babies with sensitive skin or conditions like eczema are more prone to diaper rash. And antibiotics disrupt normal skin flora, promoting yeast growth and potential rashes. Formula can cause diaper rash in babies, especially during transitioning from breast milk to formula, or even when you start feeding them solid foods. Changing diets changes baby's stool composition, which makes them more likely to get diaper rash due to irritants or allergens in the formula. Some infants experience gastrointestinal upset from a formula, leading to diarrhea and making the irritation worse in sensitive skin in the diaper area. Acidic foods introduced alongside formula is really a crapshoot and makes them even more likely to get rashes. Monitoring the baby's reaction to formula and adjusting the diet help manage the concern, and changing the diaper all the time. Did you know that baby wipes can actually cause diaper rashes? You see, the pH levels in those little cleansing towels can really mess things up on your baby's sensitive skin. If the pH is too high, it throws their bacteria out of whack, which can lead to a rash that no parent wants to deal with. Aim for wipes with a pH of about 5.5. This keeps the skin natural balance intact and helps to ward off irritation and infection. There are so many diaper rash treatments out there, it's hard to know what to use. If you're not, here's the lowdown of all of them and when to use what. First up, diaper ointments and creams are like the bodyguards for your baby's bottom. They create a protective shield against moisture and irritants while also soothing and hydrating that poor, irritated skin. Next, if the rash is throwing a rave because of too much fungus, grab some antifungal cream. Now, if a bacteria infection decides to crash this party, it's time to call in the big guns, antibiotics. Your doctor can prescribe these. But please try to fix the problem before it gets to this point, because antibiotics are very harsh on the baby's tummy. Last, and in my opinion, almost least, hydrocortisone cream is a steroid cream that can help ease that discomfort and swelling from severe diaper rashes. But it's all about getting that little tush back to comfort land. So I use this when all the other treatments don't work. I don't like steroid creams because over time they thin out the skin and make the problem worse in the long run, but short term, it's okay. Have you ever experienced a diaper rash that just won't go away? Here are some straightforward tips from a organic skincare company owner. Okay, the most important thing to do is check and change the diaper every 2 to 3 hours or right after any pee poop incidents. But the less time the skin spends in contact with moisture, the better. Slather on a good layer of moisture-proof cream or balm to help protect the baby from irritation. So let them have some diaper-free time because it's super helpful for healing and gets that airflow, and it's pretty cute. Go for diapers that let airflow in. This keeps things dry, comfy. I love bamboo diapers. Just don't use plastic diapers. Make sure the diapers fit snugly, but isn't too tight because it causes friction. Stick to wipes that are alcohol-free and fragrance-free. You want gentle products for this very sensitive skin area. Use warm water and mild soap during changes. It helps remove irritants without causing more irritation. While the baby has a diaper rash, skip powders and heavy lotions because these can actually make things worse. Keep it simple and focus on cleanliness and dryness. The second you see a diaper rash, follow these steps to get rid of it in 24 hours. Change diapers frequently, like all the time, especially when it's wet or soiled. Clean the area gently with warm water and alcohol-free wipes. Pat the area dry or let it air dry and apply a thick layer of a barrier cream or balm. Let your baby go without a diaper for a bit or as much as possible because it promotes drying, and use a highly absorbent diaper that's not too tight, and give your baby a warm bath with mild soap. If there is no improvement in a few days, it's time to call your doctor. Ever wonder how long a diaper rash should take to heal? With the right care, it usually goes away in 2 to 3 days, especially if you change diapers right after each pee or poop to help speed up healing. If the rash isn't getting better, it might be time to consult the doctor. Just remember, keep the diaper area clean and dry and use a good barrier cream to protect the skin. Now, new moms often ask me, when is the right time to call a doctor for a diaper rash? Here's the tea. The rash appears on a newborn, the rash doesn't improve or gets worse after 2 to 3 days of treatment, or if you see signs like bleeding, blisters, or pus-filled sores. Another time to see the doctor is the rash is bright red with spots and occurs while your baby is on antibiotics, or if it spreads to other parts of the body or your baby has a fever along with the rash. Time to go see a doctor. As a baby skincare company owner who has 2 kids and has helped thousands of moms, here are my best tips for handling diaper rashes. Keep it clean and dry. Clean the diaper area using a soft cloth or warm water. Gentle wipes are okay, but make sure they're alcohol free. Use disposable diapers. Disposable diapers are super absorbent and can help keep that rash at bay while it heals, but use ones that aren't plastic, like bamboo diapers are great. Make sure you're using the right size of diapers. A loose diaper can cause friction, while a tight one can trap moisture. Apply a thin layer of zinc oxide or other barrier creams or balms to protect against irritation to help keep it from rubbing against materials. There are tons of natural remedies. I swear by things like aloe vera and calendula cream. I hate scented products regardless, but especially for diaper rash times, stick to natural, unscented options to avoid irritation. Less is more here. Pay attention to how your baby reacts to different products and adjust as needed. So if you notice that a diaper rash happens whenever your baby eats dairy, stop eating dairy. Or whenever my baby would use diapers that we didn't usually use, like the Honest Company, they would always get a rash. So just stick with the diapers that work for you. Baby skincare is so important when it comes to rashes. My brand, Organics, has a lot of diaper rash options that work. So first we have our Super Balm Natural Baby Balm. It's USDA certified organic, and it's gentle, chemical-free, and has colloidal oatmeal that helps itching from rashes and eczema. It's amazing. Another product we have is my organic diaper rash ointment. It's a soothing salve made for sensitive skin. It helps with irritation in diaper-related rashes, and it just protects the skin from irritation. Then our diaper rash cream is formulated with zinc oxide and aloe vera for effective relief from diaper rash. My top tip for getting rid of baby rashes fast is protect your skin with Air Organics Diaper Rash Balm. And for seriously itchy, irritated skin, use our Super Balm.